My name's Martha Wittenberg, for those of you who don't know me already. I've been working at the Institute for Progressive Medicine since last March and do a lot of hormone replacement therapy, as does Dr. Sasson. There are a lot of misconceptions in the media and from other doctors about what hormone replacement therapy is and whether or not it's good for you. So I'm going to go over all those things tonight. So just to give you an overview of the talk, first I'm going to just talk about some problems that we commonly see that have been attributed to aging. Then discuss just a brief overview of the types of hormones in our bodies, what specifically are the benefits of reproductive hormones, and then what are the pros and cons of hormone replacement therapy. In particular, I'm going to talk about bioidentical hormones, which are the only types of hormones that we prescribe here, and why those are better. And then finally, how do you take bioidentical hormones? If you're interested in starting them, what steps do you have to do to begin? So the most common problems we see attributed to aging are weight gain. That's a very common thing as people get older. You know, they do find it harder to maintain a healthy weight. Fatigue is extremely common and can have a lot of different causes. Along those lines, somebody can be fatigued but also not sleeping well at night. Poor skin health is a common complaint. You know, people worry about their skin sagging and wrinkling, or the texture or thickness of their hair, if they have hair loss. And aches and pains are very common as well. So people start to have problems with their knees or their hips or their backs, and more joint issues as well. And then memory loss, obviously dementia is more common as people get older, but even short of dementia, people start complaining of just not being as sharp as they used to be, and sometimes they'll describe it as brain fog or mental fog. And then chronic diseases are usually attributed to aging. You know, why is my blood pressure going up? Oh, well, you're older now, you're getting older, so your blood pressure is rising. But so a chronic disease would be something like high blood pressure or diabetes, osteoporosis, arthritis, heart disease, certain cancers. You know, most of those go up as people get older. So then the question is, you know, when you look at hormones, are your hormones low because you're aging, or are you aging because your hormones are low? And I would say it's probably the latter. So what are your hormones? Hormones are basically chemical messengers in your body. So they're made in certain organs called endocrine organs, and then released through the bloodstream and travel to affect other organs or tissues in the body. So for this talk, we'll talk mostly about sex hormones. So those are also called reproductive hormones, made in the ovaries in women, primarily estrogen and progesterone, and the testes in men, primarily testosterone. But both men and women need estrogen, progesterone, and testosterone. So some people, you know, don't think about it that way. Also, thyroid disorders are pretty common too. And then the adrenal cortex is responsible for releasing stress hormones. And that also plays a role in the overall balance of hormones. So I like to think of hormones as a symphony, and they need to work in symphony. They need to work together. So one thing that we see when people do have balanced hormones overall is their mood's better, they have more energy and endurance, better physical strength. They sleep well at night and they awaken well rested. When they are exposed to stress, they can recover better. And then they tend to have more stable, healthy weight. Also, if your hormones are balanced, you get less cravings for food. So sometimes what happens as people's hormones become imbalanced, they start to have more cravings, and then they start to gain weight just from increased intake. And then again, their skin looks good, and then obviously, everybody likes this. They have better sexual performance and better libido. So who doesn't want that? So this is just a little diagram to explain the relationship between different types of hormones. So without getting into too much detail, sex hormones at the top are reproductive hormones like the estrogen, progesterone, and testosterone. At the bottom, the base, are your adrenal hormones. So that's cortisol and DHEA. If you have adrenal issues, it's going to affect your production of your thyroid, and it's going to affect the production of your reproductive hormones. So it's important, and what we usually do is also check adrenal hormones and thyroid hormones in somebody who's interested in hormone replacement therapy, because we have to make sure that they're all balanced so that you can optimize their effectiveness. And this is something maybe I've gone over with some of you in the room, but I like this mnemonic. The Sheild mnemonic was made by a Dr. Tansey, who's a researcher at Harvard. It's just about, you know, overall tips for wellness. But the point is that you can't be healthy by just taking hormone replacement therapy, that there are other things in your life that are important to do in order to stay healthy and maintain your vitality. So hormones may help you sleep better, but you also have to have good sleep hygiene and do things that support proper sleep. Handle is very important in terms of managing stress. I tell anybody and everybody, just try deep breathing 10 minutes a day, at least like 5 minutes twice a day. Just even if you can only do it once for 5 minutes, it'll have a big impact on how you feel. And then I'm not going to go through all of these, but down below, the D for detox, that's really important when it comes to hormones. In our environment, there are a lot of chemicals that act like hormones when they get in our bodies. So just realizing what they are and trying to avoid them is also important for overall hormone balance. The Environmental Working Group, EWG.org, has a great list of hormone disruptors. So they may be things that are found in personal care products like lotions. They might be chemicals in plastics or BPA, or if you eat dairy or meat from animals that have been treated with hormones, that's also going to affect how your hormones act in your body. And then the S for Sheilds is supplement. So sometimes people have poor nutrition as well. So I might recommend doing nutritional testing just to see what else you possibly need more than hormones. If there are low nutrients, I think there's nothing better than an immune drip, an immune nutritional drip to help boost somebody back up again. Yes?
You say avoid tuna.
Yes. It's very high. It's very high in mercury. Yeah, so it's very high in mercury, and the problem with heavy metals is they displace all your natural minerals, like your calcium and your magnesium. So mercury in particular can deposit in your brain, but can displace calcium, so you have thinner bones and things like that. So this organization here, the NRDC.org, they have a list of mercury in fish. And so if you're computer savvy, if you just search for NRDC mercury in fish, it'll give you a chart and shows you the fish that are lowest in mercury and the ones that are highest in mercury. Certain types of tuna, they say, are okay to eat every once in a while, and they actually have a chart to say, if you weigh this much, this is how often you can eat it. But certain types of tuna, such as ahi tuna, it says, like, try to avoid it as much as you can.
I could just avoid it, tuna if it's bad for you.
Yeah, but like who knew, right? So wild-caught salmon's really good in terms of a lot of omega-3 fatty acids and low mercury. Other things that have low mercury, like shrimp, shellfish has low mercury, but yeah, the bigger fish like tuna and swordfish have a lot more mercury. So that's also related to brain health and things like that. But if you have a lot of heavy metals, you tend to have a lot more like chronic issues too. So anyway, so what are reproductive hormones? I mentioned estrogen, progesterone, and testosterone, and men and women have both. This just shows the testosterone in men overall over time. So it tends to peak in the 20s and then will make a gradual decline. For women, estrogen tends to peak later, maybe in the 30s, and then has a more abrupt decline. When I see women who are in menopause that are not on hormones, their estrogen level is sometimes undetectable, whereas for men, it might be like 30 or 40. So in menopause, women sometimes have lower estrogen levels than men do. And what are the benefits of estrogen? So for men and women, the benefits of estrogen are, maintaining the collagen and elasticity in your skin and your vessels. So that's why one reason why estrogen is good for heart disease, because it helps with the health of the arteries. It also helps maintain and build bone density. And we see that particularly if we have women who are on estradiol pellets, who have osteoporosis, will actually see their bone density improve over years of being on the pellets. It also decreases risk of cataracts and macular degeneration. It helps make serotonin, which is a brain neurotransmitter that helps with mood. It improves sleep, improves cholesterol. I don't know if you guys are familiar with homocysteine, but this is a blood test we sometimes check as a heart disease marker. And when it's high, you have an elevated risk for heart disease and dementia, and estrogen can help bring that down. In addition, estrogen can lower colon cancer risk and dementia, an average of 34% in all the studies that they've looked at. For progesterone, one of the major benefits of progesterone is that it balances estrogen. So estrogen will make the lining of a woman's uterus thicker, whereas progesterone will keep it thinner. And so it can help prevent against endometrial cancer. But even in women who have had hysterectomies, we still recommend they take progesterone because it can also help protect the breast tissue. And then more than any other hormone, progesterone does help with sleep. So if women are anxious or they have sleep problems, oral progesterone at night really helps keep them asleep. Sometimes men have low progesterone too, and they can actually take lower doses of progesterone. Guys don't always want to take progesterone, so another thing we can give them instead is pregnenolone. So pregnenolone is an adrenal hormone, but it's the direct precursor to progesterone. So theoretically, you take pregnenolone, it gets converted to progesterone, and then you have healthier progesterone level as a guy. Progesterone is also a natural diuretic, so it can help lower blood pressure. It lowers inflammation markers in the blood, can help with thyroid hormone effectiveness, and then helps promote healthy nerve cells, particularly in the brain, similar to estrogen. And then this is just a chart of female hormones over time. So when girls are young, they don't have any hormones. During their reproductive years, they're at a pretty healthy level, and they're also cyclical. They'll fluctuate throughout the month, but they stay at a pretty healthy level. Then what I typically see is in the 30s, progesterone decreases. This is when I start to see women who say, I can't sleep, I'm having night sweats, I'm anxious, and I'm gaining weight. And basically, they have what's called estrogen dominance. They have way too much estrogen relative to their progesterone. And so they might start on just bioidentical progesterone for part of their cycle until they get into menopause. And that's when we add the estrogen. So later on, estrogen may fluctuate a lot, and then it actually doesn't stay up here. It usually comes down here. And that's when women go on hormone replacement therapy. For men and women, the benefits of testosterone are to maintain muscle mass, strength, agility, also helps with bone density, decreases body fat, helps libido. Androgens like testosterone and DHEA are really good for improving a sense of well-being and also help maintain memory and skin health. And then for men, again, typically the testosterone goes down a little bit slower over time. The interesting thing with men is sometimes, unlike women, their estrogen will start to increase. Not to super high levels, but definitely higher than a woman in menopause. And so that will increase body fat. Sometimes men will develop male breasts and things like that, and they definitely don't like that. And then, so this is similar to the first slide that said, problems attributed to aging are basically also the signs and symptoms of low hormones. So a lot of these problems can be addressed by doing hormone replacement therapy. And so this has a lot of information on it. The slide, I'm not going to read all of it, but basically we typically evaluate somebody first by doing blood tests, and we do a pretty complete blood panel. So I put down all the tests we do, just in case somebody wants to go back to their doctor and say, can you check these tests for me? I had somebody who had Kaiser insurance, not to badmouth Kaiser, but just the other day, and she said, I just had my blood work done. My doctor told me everything was normal and my hormones were good. Well, the only test the doctor did was this one, FSH. So this is generally high in menopause. So this test was still normal for her. So he said, your hormones are fine. But he never really checked her estradiol, progesterone, or testosterone level. So you don't really know that. You just know the messenger is still okay. And then we also usually check DHEA, the pregnenolone, and cortisol, just to see how those are doing, and a full thyroid panel. So I included all the tests we usually do, because again, a lot of times only this one TSH test will be done, maybe a free T4. But you really need to see all the hormone levels to know if there's a problem, where the problem is. And then salivary testing you can do. We don't do it as commonly unless we're checking the cortisol. So if we're concerned about the adrenal gland, the adrenal hormones, you can check a salivary cortisol test where the person collects their saliva after waking up, around noon, in the early afternoon, and bedtime. And basically cortisol should be highest in the morning. It's like your get up and go hormone, and then it gradually decreases throughout the day. And so what we see in some people with a lot of fatigue is it's too low in the morning, or if they have a lot of stress during the day, they'll have a spike in the middle of the day when it actually should be trending down, and that can affect their sleep and create inflammation and other issues. So sometimes we do this if we're really worried about the adrenal gland, but not always. And then in terms of urine testing, this is more for somebody that's already on hormones. We would check a urine test to make sure that they're metabolizing the hormones that we're giving them in a healthy way. And then, so the benefits of the hormone replacement therapy, you look better, and then you can also decrease your risk for many chronic illnesses like osteoporosis, heart disease, breast and other cancers, and dementia. And it's simple. It's simple to do. It's not as complicated as it seems. But this is a question I get a lot. Do hormones cause breast cancer and heart disease? So that's what women want to know, because that's what women heard from the media or from other doctors they go to say, don't take that. It can cause breast cancer, or you have a family history of heart disease, that might be harmful for you, you shouldn't take it. But no studies that have been done on bioidentical hormones support the notion that bioidentical hormones cause breast cancer or heart disease. So the only studies that showed an increased risk for heart disease or breast cancer were done with synthetic hormones. And then for men, they want to know if testosterone causes prostate cancer, because that's also something that they maybe heard in the news. We don't give testosterone replacement therapy to somebody who has prostate cancer, because in some cases it could stimulate the growth, but in somebody without prostate cancer, testosterone is not the cause. Does that make sense? And when you think about it logically, if testosterone falls 1% every year after the age 40, then somebody who's 80 has testosterone that's 40% lower than somebody who's 40, but who's more likely to get prostate cancer? The 80-year-old is, right? So if testosterone causes prostate cancer, it would be more prevalent in 20-year-old men. So doesn't make sense. So what are synthetic hormones? Synthetic hormones are basically man-made hormones that are then patented as pharmaceutical drugs and sold through traditional pharmacies. And they're different in structure than what your body makes. So they don't send the same signals as natural hormones do. And sometimes they can actually interfere with the signals of your natural hormones. So for women, most commonly, Premarin is the most common synthetic estrogen. So it gets the name Premarin because it's from pregnant mare urine. So it contains estrone, which is a more inflammatory form of estrogen. And then Provera is the synthetic progesterone that was used in a lot of studies. The real name is medroxyprogesterone. So they actually took natural progesterone and changed it, because then you can patent it and make it into a drug and sell it. And so this technically isn't progesterone, it's called a progestin. So any progesterone that's synthetic should be actually called a progestin. And then part of the problem is when you look at studies on hormone replacement therapy, often they don't separate out whether or not the person was on a progesterone or a progestin, and they just lump it all together. So it's hard to interpret the results. And then Prempro is a combination of the estrogen and the progesterone that used to be available, but there were 2 studies that showed a lot of negative effects of this combined synthetic hormone replacement therapy, and so this was basically taken off the market. But that's where all the bad ideas about hormone replacement therapy come from. And then methyl testosterone is an oral capsule that really isn't used anymore because they found a lot of liver problems in people that were taking oral testosterone. So overall, testosterone should never be given orally unless it's something like a sublingual drop or a troche that's going to dissolve in your mouth and get absorbed through the mucosa in your mouth. It shouldn't be swallowed and metabolized through your liver because it can cause problems. And then this is just the first study that showed that synthetic hormones were more harmful. So they followed 15,000 women ages 50 to 79 taking combined synthetic hormone replacement therapy. So again, not bioidentical. And they stopped the study early because they found that the women who were taking the combined horse estrogen with the progestin had increased risk for heart attack, stroke, breast cancer, and blood clots. There was a slight decrease in colon cancer and hip fractures, but obviously, that wasn't enough to offset the huge risks of taking the combined synthetic hormones. In the same study, they found that people who were only taking the Premarin actually did have less heart disease and breast cancer, but still higher risk of stroke. And then the second major study was called the HERS study. This looked at the same combined synthetic estrogen and progesterone called Prempro. And this looked at women who already had heart disease. So they already had a heart attack or a stent or something, but they were known to have coronary artery disease. And they wanted to know if putting them on Prempro would decrease the risk for having more heart disease in the future. Basically, they found it didn't decrease their risk for other cardiac problems, but it did increase their risk of blood clots. So again, this was another thing that led people to come to the conclusion that combined hormone replacement therapy is bad for you. But again, it was combined synthetic hormone replacement therapy, and that's the big difference. So basically, after the study, women who were having menopause symptoms were no longer started on hormones. Those who were already receiving them were told to stop them. And then a lot more antidepressants were prescribed, such as Prozac, to help with hot flashes and some of the mood changes. But those types of medicines really don't do anything to improve your hormone levels, obviously, and they have a lot of side effects. So those were not a very good long-term solution. And then this is just a list of all the problems you get with the synthetic progesterones called progestin. So they don't balance estrogen, and then they also block the positive effects of estrogen on the heart. And so progestins are just overall bad. And all the studies that they looked at, if the progestin was added to the estrogen, the outcomes were always worse. And along those lines, they found that oral estrogen is worse for you. So it's not good to take estrogen orally because that can still increase your risk for blood clots. So those are two things we never do. So bioidentical hormones, again, are natural hormones identical to what your body makes. So there's nothing different. There's 3 different types of estrogen, estrone, estradiol, and estriol, and then there's progesterone and testosterone. And then they're better because they, decrease inflammation. They don't cause the arteries and the coronary to spasm, which can lead to stroke or heart disease. And then in the studies that have been done on the bioidentical hormones, they have found lower risk of breast cancer, heart disease, and dementia. And then these are just some studies that were done on bioidentical hormones. So one was on women using estradiol as a cream and progesterone, and they found no increase in breast cancer, and that followed 3,000 women for 9 years. That was done in France. Another one that compared the transdermal estrogen with oral estrogen just reinforced the fact that oral estrogen can increase your risk of blood clots. And this one looked at coronary artery calcium scores. So the higher the calcium score you have in your coronary arteries, the more plaque you have. And so these women, they looked at women who were on estrogen replacement therapy and those who were taking placebo. And the ones on estrogen had lower coronary calcium scores at the end of the study. And then this study is similar, but it looked at the thickness of plaque in the carotid arteries. And they found that women who were taking estradiol with or without progesterone had thinner plaque linings than the ones that were not. But they did find it was most effective if it was started after menopause, within 6 years. And then, so if somebody's interested in doing bioidentical hormones, how are they prescribed? So all hormones can be prescribed through a cream. Certain hormones like progesterone can be prescribed orally. Sublingual drops can be prescribed for progesterone, estradiol, or testosterone. Injections used to be popular for testosterone, but they're not truly bioidentical. They have an extra little molecule added onto them, and they may cause liver problems. The other thing about injections is you have a lot of peaks and troughs, so you don't get a steady state. We don't like it as much. And then pellets are usually what we see the best results with. So creams can be made by compounding pharmacies. So for a man, you can put testosterone in with chrysin, which is another compound that decreases testosterone from becoming estrogen, right? Because if you give a man more testosterone, he may convert some of that to estrogen, which you don't want. So testosterone cream can be combined with chrysin, which it has like a little bit of a yellow color, but it doesn't stain your skin. And for women, if she wants, she can put her estrogen, progesterone, and testosterone all in her cream.
Quick question.
Yeah.
Putting them together, how is it determined what ratio to have? How much?
So usually we'll start at a low level of the chrysin, like 25 milligrams, and then check, the estradiol level. And if it's too high, we'll increase the chrysin.
Right.
So.
I was familiar with the testosterone cream and then the anastrozole.
Okay, so that you can also do that. So with testosterone cream, you can also take anastrozole, which is an estrogen blocker. Yeah, which is an estrogen blocker. Usually men will take like a 0.5 milligram twice a week, or start with a low dose, but then if they're converting too much testosterone to estradiol, we'll increase that. So yeah, chrysin can be added to the cream, so you don't have to do two things. Just like progesterone can be added to the cream, but I like to give oral progesterone to a lot of women, so they end up doing two things. But yeah, so you can do testosterone cream with anastrozole, which blocks the conversion of testosterone to estradiol. Men can also take Clomid with their testosterone. It's a testosterone booster, but clomiphene. Sometimes that has more side effects than anastrozole. It's more common that we give anastrozole than Clomid, but we do have some patients that are on it. And then for women, when we compound estrogen cream, we give women estradiol, which is E2, and estriol. If you go to a pharmacy to get a prescription medication for estrogen, it'll just have the estradiol, and it has very limited strength. So that's why we like to use compounding pharmacies, because we could add the estriol, which is very good for breast cancer prevention and vaginal health, and then we can adjust the dosage any way that we want. They'll make it. And then, sorry, there aren't that many women here, but I have a lot on estrogen. Okay, last slide on estrogen. So this just talks about second to last slide. This one just talks about the different types of estrogen. So E1 is most common after menopause. And, but they think that high levels can contribute to breast cancer. E2 is most potent. It's actually 12 times more potent than E1 and 80 times more potent than E3, but it does have positive effects on the bone, heart, and brain. And then estriol is the least powerful, but we add it to the cream because it's thought to be most beneficial at protecting against breast cancer and assisting with vaginal health. And part of the reason may be because of which receptors they bind to. I know this is kind of technical, but basically you have two types of estrogen receptors, alpha and beta. The alpha ones stimulate cell growth, so could potentially stimulate breast cancer growth, and the beta ones inhibit growth. So what they know is that estradiol equally binds alpha and beta, so could go either way in terms of its effect on breast cancer risk. Estrone binds the alpha receptors, which cause cell proliferation in a 5-to-1 ratio. So not as protective, potentially harmful. But estriol does the opposite. It preferentially binds the beta receptors. So that's why they think that it helps protect against breast cancer, and why we always add it in the cream. And then oral capsules can be compounded for progesterone. I like this for people who are anxious or have sleep problems. And then also for men and women, we'll often give pregnenolone or DHEA if we know that they're low in that as well. So for DHEA, for instance, a woman may only be on like 5 or 10 milligrams, a man probably like 25 or 50. So this is an androgen, and men usually require more of those. And then pregnenolone is the precursor to all the other adrenal hormones, and men also usually are on a higher dose of that. Okay, and then estradiol and testosterone, again, we never prescribe those orally. And then why use hormone pellets? We love hormone pellets. This is what they look like. They're very tiny. So that's probably a testosterone, like a 100 milligram pellet. Estradiol pellet would probably be like a quarter of that, so super small. We like them because they're bioidentical, and there's been support for them in the medical literature since the 1940s, so we know they've been used for a long time and they're really safe. They're from plant-based ingredients, and we have them specially made at compounding pharmacies. And one thing I used to always hear from people is, oh, well, my doctor told me not to get anything from a compounding pharmacy. Compounding pharmacies aren't safe. Well, they are regulated now by the FDA. So any compounding pharmacy that does any sterile ingredients, like a pellet, they come sterile, has a special licensing from the FDA and is inspected by the FDA. So you can feel more confident that what you're getting is a good quality product and is safe. And then basically it's like a very easy procedure where we insert it into the subcutaneous tissue around the bottom, which sometimes is a challenge for men because sometimes men don't have that much padding there, but women usually do. And why we like it is because you don't see any peaks or troughs, so the hormones are absorbed equally over time. So very gradually we get very steady hormone levels, and people do really well on them. And after the initial procedure, you don't really have to think about it anymore, and then it can last up to 6 months. And that depends kind of how much people exercise, how fast their metabolism is, but for some people they stretch it out for 6 months. So usually, like if we want to do pellets on somebody, we'll do baseline labs just to see where their levels are before the pellets. Then we do a little injection of lidocaine just to numb the area up, and wait about 10 minutes to make sure it's working. And then we'll do a really tiny incision with a small blade. And then we use a trocar insert the pellets of both estradiol and testosterone in women. Men will get testosterone and a little bit of the estrogen blocker, anastrozole. So we usually just put that in with the pellets when we do testosterone pellets in men. And then we don't even suture it up. We just kind of cover it up, and we give people precautions, not to bathe or exercise vigorously for the first few days. Yes? That's a good question. I know Nick knows for Medicare, this is crazy. You're not going to like this. They cover the pellet insertion for men, but they don't for women. I mean, I know you don't have Medicare yet, but yeah. So for men, they have to pay for the cost of the pellets because Medicare doesn't cover compounding pharmacies, and most regular PPO or HMOs don't cover compounded medications. So usually the pellets aren't covered, but in men who are over the age of 65, the pellet insertion is covered. And how much is the pellet insertion, Nick? $400. So divided by 3 to 6 would be, the monthly cost. And then usually, so for women, they still have to take progesterone, right? Because we want to protect their breast tissue and their uterine tissue. So we'll usually have them continue their oral progesterone at night. And then just to see what their levels are when it's optimized, we'll usually have them recheck hormone levels 4 to 6 weeks after we place the pellets to make sure that they're on the appropriate dose. And we'll also go by how they feel as well, too. And then, people start to feel when the pellets are wearing off. Women might start to have some hot flashes again, or men might start to have like more fatigue or decreased libido, and then they'll make the appointment to come in. And then, so if that happens, 4.5 months after you have your pellets placed, you might just make your appointment for, 4 months next time, so you don't have to have any menopausal or andropausal symptoms. And then, so what are the side effects if you use bioidentical hormones? Usually you only see side effects if the dose isn't totally balanced. Too much estrogen will cause breast tenderness or vaginal bleeding. So that's a big thing we look out for women. Too much progesterone sometimes makes women emotional. But if they do get emotional, sometimes you can give them vaginal progesterone. Also, if they're on a higher dose of progesterone and take it late at night, they can feel sleepy during the day. And too much progesterone can convert to cortisol, which too much cortisol is not good for you either. And then bloating and constipation can happen. For testosterone, we usually see like either aggression, irritability, overactive sex drive. The thing we worry about medically is an elevated blood count. So testosterone helps your body make red blood cells. And so once you start giving somebody testosterone replacement therapy, they might have a spike in the amount of red blood cells their body makes. You don't want to have too high a red blood count because then it could put you at risk for clots and things like that. So if the testosterone causes like a huge jump in blood count, we tell people to donate blood like periodically, and then it just comes down. And let's see, so dosing considerations, no matter where you go, it's good to start with the lowest dose and increase gradually. The worst thing you can do is put somebody on too high a dose. You don't know how they're going to react to the hormones or how fast they're going to metabolize it. It's always good to start lower and just gradually increase the dose. A woman who's starting out may want to start with topical creams and then eventually transition to pellets. Men, sometimes we just start them on pellets because they rarely ever come back complaining that, like, I didn't like that. They always like it, but women sometimes will have the breast tenderness and bloating, and it's better to start them with creams and more gradually transition them to pellets. Young men who have low testosterone may sometimes not be a candidate for testosterone because theoretically it could cause sterility. So in certain cases, we may give HCG instead of testosterone to naturally boost testosterone. And then for men, if the estrogen rises, we can either add the chrysin to the cream, the anastrozole, or the Clomid. So usually we use anastrozole in most cases. And then just to make sure everything's working well, it's good to optimize thyroid and adrenal hormones as well. So whoever is going to be managing the hormone replacement therapy, it's good to have that doctor look at the thyroid hormones and the adrenal hormones and make sure that they're all working together. And let's see, so this is basically what we do when we monitor treatments. If we start somebody on hormone replacement therapy, we'll recheck the labs 2 to 3 months later. Pellets a little sooner because it starts to work quicker. And then for men, we like to do a PSA at the beginning. So that's a prostate screening test. And 3 months after starting the hormones to make sure that there's no spike in the prostate test. And then after that, annually. And then someone who's been on hormones for years and is on a stable dose just needs to do their hormone test once a year. And especially for women, because of estrogen metabolism, I usually have people check urine for hormone metabolites at least one time just to make sure the hormones are getting metabolized in a healthy way. Yeah, and that's about it. Thank you guys for coming.